There are probably few topics that have as much misinformation on social media as birth control. So today we are tackling this head on, and we are taking on your main questions and the biggest myths about birth control methods. Most people think about birth control, they're usually thinking about the birth control pill or the oral contraceptive pill, which is a medicine you take one pill every single day to prevent pregnancy. The truth is there are lots of different types of birth control, and there are different types because there are different things that fit people's lifestyles. Some people may not want to take something every single day. They may want the convenience of a longer acting method like an IUD, which is a device that goes into the uterus, or a contraceptive implant like an Nexplanon that goes in the skin of the arm, so you don't have to remember something all the time. Pulling out, or the withdrawal method, is actually a type of birth control, meaning that it is a plan for preventing pregnancy. The trouble is it's not a very effective one. A lot of people can get pregnant if they are just using the pull-out method. There's a little bit of sperm that can come out before someone actually ejaculates. So if you are absolutely sure you do not want to get pregnant, you may want to use another method of birth control with it that may be a little bit more reliable. There's a really big myth that if you take the pill or birth control, that is going to make you infertile. The reason that this myth exists is because if you take the pill from the time you are 15 to the time that you are 45, it is much harder to get pregnant when you're 45 than when you're 15. And that's just because of aging. As you get older, the eggs in your ovaries can start to break down and there are fewer of them. So it's harder to get pregnant as you get older. So it's not that the birth control actually caused problems with fertility. It's just that if you took it for a long time, your fertility went down naturally. Technically, drinking or using recreational drugs doesn't affect the effectiveness of birth control, but what it might do is make it more likely that you might forget to take your birth control or use it wrong. It's definitely a myth that people will gain weight if they take birth control like the pill. The only birth control method in studies that has been shown to cause weight gain is the Depo-Provera shot, which is the hormone injection that's used every 3 months. The regular birth control pill, at least in research studies, has not been shown to cause significant weight gain. The only birth control method that actually protects against sexually transmitted infections are the male and female condom. So barrier methods that actually are used for both birth control and STI prevention. So if you are wanting to make sure that you are preventing pregnancy and infections, you may want to use either condoms by themselves or condoms with another birth control method. Only some type of birth control methods are hormonal, meaning they contain hormones that prevent you from ovulating or releasing an egg. Other type of methods are like barrier contraceptives, which prevent sperm from reaching the egg, and also things like the copper IUD, which work by also mobilizing sperm and preventing them from getting to the egg. Different birth control methods work in different ways, and one of the ways that they're different is how quickly they are effective to prevent pregnancy. For instance, things like condoms work the second that you use them. But methods like hormonal birth control pills can actually take a little time to start working because they take over your own cycle and prevent ovulation. I hope this provided some clarity about the different birth control methods and debunked some of those common myths and misconceptions. If you have any questions, make sure you leave them in the comments below. And if you want more information about women's sexual and reproductive health, make sure you subscribe to our channel.